So good morning, everybody. As Karen mentioned, I have the pleasure and privilege of chairing the All-Ireland Institute of Hospice and Palliative Care Education Network. And it has been really, really wonderful working with Karen and Melanie and Sarah to reinvigorate and to really bring us back together again as an education network and to start planning for the future. And the first step is to welcome you to this first event in the new iteration of the AIIHPC Education Network, where we're looking to shape the future through innovation in palliative care education and practice. Many of you will know that I've been involved in palliative care education for the guts of almost 25 years now. And my belief is that education is key to evidence-based practice for those working in healthcare, and more particularly in palliative care. I have always believed, and continue to even to this day, that every day is a learning day. We learn from the patients and the families we care for at the most complex and critical times of their lives. We learn from our colleagues. We learn from attending education practice updates and events such as this one. And we learn particularly when we apply what we've learned into that practice on that day-to-day basis. As I said, our mission with the Education Network is to collaborate, to share, to cooperate, but also to recognise innovation and to champion it where we see it in ourselves, because quite often we on this gorgeous island called Ireland tend to shy away from praising ourselves. And I'm going to draw on a term that Professor Suzanne Gearan, many of you will know from her work with the research side of the Institute. And she talks about the humble brag. And maybe we need to start in education to humbly brag loudly about what we do, because without us, nothing would change. So today is about showcasing really good initiatives, both from Northern Ireland and the Republic of Ireland. It's about showing some key developments and innovations that have been happening and are continuing to happen. And it's also to honour education and its place in palliative care. I'm delighted to be able to welcome our keynote speaker, Professor José Pereira. José is Professor of Palliative Care and Medical Education at University of Navarra in Pamplona in Spain. And he's also works in the Institute of Society and Culture, headed by another colleague of ours, Professor Carlos Centeno. And José is well known, not just in Europe, but also in Canada, where for many decades he worked there, and really was key in the development of the work of Pallium Canada. I and some of colleagues sitting here have the pleasure of working concurrently with José on a project that we'll hear about later called Code Ya. Our colleague Dr. Mary Nevin will tell us about the work we've been doing in that. And as a colleague, there is nobody that's more collaborative, sharing and kind in their work in palliative care education that I've ever met. So it's my pleasure to welcome José to speak to us about new technologies versus traditional approaches, a case of the baby and the bathwater.